Hey everyone! Welcome to the Dr. Mama Minute, where Dr. Burton will share snackable bits of information based on things going on in her life, in her practice, or things being discussed in her social media channels. So sit back and prepare to be dazzled by topics that you may or may not have thought were important in your life.
Hey everyone, this is Dr. Burton popping in for the next episode of the Dr. Mama Minute. So today I want to share some of my thoughts about earache causes. Okay, so let me just say this loud and clear so everyone in the back can hear. An earache does not mean an ear infection. If you remember nothing else, remember that. So now that the fall has arrived, cold and flu season are right around the corner. This is an important time to remind parents that there are many, many causes of earaches. The purpose of this episode is to help everyone to understand how wide of a range of problems can cause ear pain. Now is also a good time for me to highlight that pain is very personal. The louder your child cries does not always match the degree of an injury or infection. I know we all know kids who scrape their knee, limp around for days, and show you their scabbed over skin for a week. Well, I in fact had such a child. I kept a drawer full of colorful Band-Aids that I collected every time I went somewhere. There were princess, cartoon, sparkle, glittery, you name it, we had it. We also had something called the Boo Boo Bunny. It was a little plastic refreezable ice cube that was surrounded by soft covering. This was kept in the freezer in a drawer that my child could open. So whenever drama happened or something was scraped, immediately there were some hugs and kisses, but the crying continued, and I immediately pointed out that there was a Band-Aid drawer that needed to be explored, and perhaps she needed to go find Boo Boo Bunny. Happily, she forgot her pain, grabbed her little bunny, and held it to her skin while she searched/played in the Band-Aid drawer, looking for that perfect treatment. Sometimes there were several Band-Aids placed in different parts of her body all at the same time. I eventually had to even stop trying to put on Band-Aids because she would be really angry telling me I didn't put it on the right spot. Is it really my fault that I could not see the cut, scrape, or injury that led to all these screams and tears? I mean, I'm a physician. I should be able to see the boo-boo, but I accepted it. If it makes you feel better, do that. So my point is, you need to understand who your child is. Louder cries do not mean a more severe medical problem. Do some of the things you normally do. Are you able to distract your child, whether it's with Band-Aids, painting fingernails, a lollipop? If it's a broken leg, if it's something big, the lollipop doesn't cut it. On the other hand, I've met kids with bulging ear infections with no symptoms. In fact, sometimes kids rupture their eardrum before parents know that there's an issue. For these kids with high pain tolerances, parents have to look for more subtle symptoms of pain, like off and on pulling on the ears or head shaking, rubbing their ear with the back of their hand. I also submit to you, it is not a common thing for a child to take their finger and point it directly down into the ear canal. There's a lot of ways we can rub our ears, but an index finger pointing straight into the ear canal, usually there's something else going on in there. So now as we start talking about earache causes, let's be clear, ear infections are an important member of this group. Since I'm an ear surgeon, this is something I deal with every single day. And I've already shared many posts that have already discussed things like ear infection facts, chronic middle ear fluid, including that dreaded glue ear, methods of preventing or reducing ear infections, and even some of the severe complications people don't think about when they think of a typical ear infection. I also shared important information about what you can expect from the ear surgery and gave information that you may need to know about ear tubes. Ear tubes can be wonderful, but there's also some severe complications from them. I added links to some of these posts that I just discussed into the show notes, so if there's something that you're interested in, you can go back and that might be an easier way for you to find them. Despite the need for me to place tubes in kids every week, most kids with ear infections do not need ear tubes. And that's because most ear infections will go away on their own without antibiotics. In fact, you should be praising, celebrating, high-fiving your physician for not giving you unnecessary antibiotics. In fact, I added a link in the show notes to a post by one of my colleagues, Dr. Christina Johns, who has decades of experience as a pediatric ER and urgent care pediatrician, and her post is very powerful because it highlights some of the significant side effects and complications of antibiotics. So if you don't need them, please don't take them. Also remember, most ear infections happen when the child gets a cold, which is a viral illness. Last year, I wrote a post about some of the hilarious myths about the common cold. Not because they're really funny, but because I want you to laugh out loud, laugh them away every time you hear them. They're very common and are repeated every single year. Now, colds may lead to some really serious complications and treatment may be needed. But remember, antibiotics will never ever treat a viral infection. Just saying. Because ear infections are so common, many parents look to ear tubes as a great way to get rid of them. Now here's time for me to say something else loud and clear for everyone to hear. Ear tubes do not stop ear infections. They simply make the symptoms less severe. They give you another way to treat them with ear drops instead of antibiotics. But they do a really great job of getting rid of those severe earaches. So there is that. Having an accurate diagnosis is extremely important, and that's true pretty much for everything in healthcare. Just because you assume you know what the problem is doesn't make that really be the problem. A red ear does not mean ear infection, just like an earache does not mean ear infection. A red throat doesn't mean strep throat, does it? Of course not. Red is just a description, doesn't tell you what the cause is. Most people also assume that earaches and ear pain mostly just happen in kids, but they happen in adults all the time too. Earaches can be grouped into two categories, primary and secondary. The primary earache causes are things that start in the ear, but that still doesn't mean that it's just an ear infection. The ear has more problems than just infections. And there's also different areas in the ear, so I always remind people to ask their treating physicians which part of the ear is involved because the management is different in different areas. So let me just share a small sampling of some of the primary earache causes. Outer ear infections like swimmer's ear, fungal infections, anything that can cause swelling and infection of the skin of the ear canal. The middle ear infections, these are the classic ear infections that can be acute with fever and pain or chronic with fluid and hearing loss. There's also the inner ear infections, which happen in the bony area of the ear that has a snail-shaped structure, something you learned about back in high school science class. Every day I have people come in and tell me they have an inner ear infection when they mean middle ear. So if you're told ear infection, take a minute, ask which part of the ear. The most common reason I see ear pain is from eustachian tube swelling. That's the drainage tube that goes from the ear to the back of the nose. So any reason that you have nasal congestion, colds, allergies, whatever it is, it causes blockage and painful swelling, still not an ear infection. Other skin disorders of the ear canal can also cause pain, such as eczema or psoriasis. Earwax impaction can also lead to pain. And this impaction is made much worse by Q-tips. So let me get up on my high horse and tell you, do not put Q-tips in your ears. Foreign bodies of the ear can also cause pain. Kids can put anything in their ears and removing them is a common job of mine. There can also be pain on the outer part of your ear where the ear looks red and swollen and hurts when you touch it. And lastly, tumors. Tumors of the ear can cause pain. Now on to those secondary earache causes. These are the problems that cause ear pain that send you to see your physician, but the real problem is happening somewhere else outside of the ear area. I usually just call this referred pain, and this can happen anywhere in the body where a problem is causing symptoms in a different part of the body. Some common secondary earache causes are allergies and nasal problems, sinus infections, dental problems like cavities, a cracked tooth abscess. The jaw joint can also give ear pain. That joint is called the temporal mandibular joint. Tonsillitis and pharyngitis, a very, very common cause of ear pain. Most of us have had a sore throat when we swallow. We feel some sharp pain in our ear. You would think people would mostly complain about their throats, but the ear pain is often the worst part that sends them in to get checked out. Also, gastroesophageal reflux is another common problem. This leads to some of the throat inflammation or nasal swelling that I've already discussed. But without the classic stomach symptoms, it may not be suspected, and this is why this type of reflux is called silent reflux. And the last category, tumors, because even though they're not usually the problem, tumors can always be the cause of anything anywhere in the body. So we put them in there just to be complete. Now, the treatment of earache depends on the cause because just as I shared quite a few earache causes, there are just as many treatment options. I belong to several Facebook groups about ear infections. Sometimes I engage and make comments, but I usually just read and learn how people approach their problems. This helps me to be a better physician because I understand their thought processes better. But the common theme I see is that an accurate diagnosis has not been made. Everyone shares all their treatment options, but I know that all the different things they're sharing are treating different problems. Please see your physician to discuss your specific problem so an accurate diagnosis and treatment plan can be set up. And this is a good time for me to say something that I think physicians everywhere want you to hear. You are going to the doctor for their opinion based on their extensive education and training and years of experience. You are not going to bring them your internet printouts or recommendations from your Facebook group or to straight up ask for antibiotics. Nope, that is not the reason for your visit. And lastly, before I go, I just want to let you know that I added some great links to the bottom of the show notes of this episode. One is for that boo-boo bunny I described that saved my life when my daughter sounded like her leg was broken. But I also put a variety of links to ear blogs by several outstanding physicians. These posts may interest you, but be sure to browse around on their website and see the wide range of topics that they write about. All right, my minutes are up for now, so it's time to go. Until the next time.
Thanks for listening to the Dr. Mama Minute. Now you can go back to living your best life.